Hi guys, it's Sarah. Back today with another pre-op video. Today is Wednesday, November 21st, which means it's exactly 1 week before I leave for San Diego and then on to Mexico for my surgery on November 30th in Mexicali with Dr. Sevas. I thought I would make a video today about a topic that I think a lot of people who are overweight have had to deal with. But before I get into that, I wanted to just do a quick pre-op diet update. So still on the pre-op diet, doing well, still having a lot of cravings and a lot of hunger, but it's not as sort of out of control as it was the first few days. Feeling a bit less foggy, mentally speaking anyway. Still don't have a lot of energy, to be honest. My energy's, down for sure. But overall, I haven't really had a problem sticking to it. I will admit that last night I did have 10 kernels of microwave popcorn with my husband. But, it was good. So what can I say? For cheating, I think it was probably pretty low on the cheating scale. So thus far, I've lost 7 pounds on this pre-op diet that I've been doing for the past 5 days, which means that overall in the past 8 weeks, pre-operatively, I've lost almost exactly 30 pounds. So I'm really happy with that progress. I think, I wanted to prove to myself that I could lose some weight. And really, that wasn't even the main goal, was necessarily the weight loss, although that's, one way of measuring whether you're getting to the goal, but it was more just trying to stick to the diet plan. And the weight loss came along with it, and that's great. It's good. Anything that I lose now is stuff I don't have to lose later. So good to know. So yeah, I'm happy with the way that's going, and it hasn't been easy, but it's getting better. I'm getting used to it, and I think it's going to be okay as far as sticking to it until my surgery date rolls around. What I wanted to kind of talk about in the video today was doctors. So I may have mentioned on a previous video, or I know that I did mention on my blog, that I switched doctors and I went to a new doctor the other day. She's actually my husband's doctor, but myself and my children were still going to our old doctor. It was about half an hour away where we used to live. We've been still going for about 5 years to the same doctor, just because, I don't know, as a doctor, he's really great, but I don't go to the doctor all the time. I don't bring the kids to the doctor all the time. Unless there's something seriously wrong, I'm not at the doctor every 5 minutes. So, yeah, I just thought, what's the big deal? It's in the same town where my parents live, so if I had to go to an appointment, I could always drop the kids off with them or go and visit them at the same time. So it wasn't really a big deal. But, because of this situation and knowing that I'm going to have to go to the doctor more often, even just for blood work or checkups, I figured I should change doctors. But I had a bit of trepidation about it because I wanted to make sure that she was okay with taking me on as a patient, knowing that I was having this bariatric surgery. So I went to visit her on Monday, and it was kind of strange, I'll be honest. She's very nice, she's perfectly nice, very competent doctor, but I really think she didn't know anything about bariatric surgery. Even when I talked about the kind of surgery I was having, she sort of stared at me blankly. Like, I don't think she has any idea what, bariatric surgeries are about. I'm 99% convinced I probably know 10 times more than she does about it. But she was willing to listen to me, and she realized I had done my research and that sort of thing. And basically she said she was willing to take me on, and she would do as much as she could do to help me with any issues that might crop up or anything that needs to be done, but that I needed to be aware that, obviously her reach only extends so far, and that if I had a serious surgical complication, that that there may be an issue trying to find a specialist. And I'm not going to go into how our healthcare system works here, but suffice it to say, she's right. There might be a complication just in finding a doctor, because the way our bariatric system works here is very specific, and it's very internalized within the bariatric centers. So that said, she was okay with taking me on and understanding what I was doing. So that was great. I was happy with that. I was glad that She didn't just outright say like, forget it, I'm not interested, move along to someone else. And I get the feeling that she is totally okay with me sort of doing my own research and advocating for myself, which is great. I think that your doctor in general should want to work with you on your health, not that you should just be going there and having them tell you exactly what needs to be done. I think there needs to be a discussion and a back and forth. I think you need to see your doctor as your partner in your healthy lifestyle rather than just as someone who, solves your problems or tells you what to do. So it seems like she's okay with being my partner, with having that kind of relationship. So I'm happy about that. So overall, although I only saw her for 10 minutes, I'm thinking that it's going to work out, hopefully. Going to the doctor, though, is always an uncomfortable situation for me because it's not like, again, I've been overweight forever, so it's not like I'm not used to doctors telling me, hey, guess what, you need to lose weight. Basically my family doctor stopped saying anything to me. We had a discussion about it once, and then that was it. In the past, it's been a little easier because I haven't been to the doctor that many times. I've been lucky that I haven't had any sort of major illnesses. I only had surgery one time before I had my children and had C-sections. When it really started to become obvious was when I was pregnant with my kids. And the bias that some doctors had because of my weight was really apparent. So the first obstetrician that I was sent to, they didn't want to deal with me. Their excuse was that they felt I would be better served by our high-risk clinic at our local hospital because they had, bigger blood pressure cuffs and because they were better equipped, as they put it, to deal with my particular situation. And at the time I thought, that's cool, no problem. I'm not going to say no to being, sent to the high-risk clinic. They have some of the best doctors in our area when it comes to fetal health and, mother's health and that sort of thing. So it wasn't a problem for me, but the way I was treated at my first appointment in that office pretty much said it all. And later on, once nothing out of the ordinary happened with my pregnancy, the gestational diabetes that the obstetrician was convinced I was going to get didn't happen, and I didn't have any complications, the high-risk clinic actually tried to send me back to the obstetrician, and they refused, saying that they felt it was easier for them to just keep me there. So I just think they really didn't want to deal with me. They didn't want to deal with my situation, and I can't imagine what reason they could have had other than the fact that I was overweight. So in the end, it worked out great. I had a fantastic doctor. I had a great experience. But I was irked by that sort of attitude. So when I got pregnant the second time, I was sort of wary of what was going to happen. I didn't think they would send me back to the high-risk clinic since they had tried to sort of get rid of me the first time because I didn't have any actual high-risk issues. But I had gone in to visit my doctor, and my old doctor was actually a professor of family medicine at the local medical hospital, or medical university, I should say. So he often wasn't there, and I saw his intern, it so happened, when I was first pregnant, and his intern was really different than most of the doctors that I've seen. He wasn't necessarily surprised that I was so healthy, even though I was overweight. So I remember him taking my heart rate and saying, wow, you have the heart rate of an athlete. That's great. That's fantastic. And he told me that he felt like it was certainly possible that because I had been substantially overweight my whole life, that my body was just used to stasis, the way things were. The status quo was that I was fat, and so my internal systems just got used to that. Which is a scary thought when you think about the idea of losing a huge proportion of your body weight and what that's going to do. And I hope that it doesn't cause any complications for me in that sense, in the systemic sense. And, who knows? I don't know. I have to believe that being, less overweight than I am is going to be healthier for me. I've got to move forward with that idea. But it was an interesting idea that he sort of planted in my head that maybe there was a reason why I didn't have any issues. So the whole time, I think during both of those pregnancies, I generally had good reactions from most of the doctors that I was dealing with. They weren't terribly sort of overwrought with my huge overweight, morbid obese self. And actually there were a few times that it was sort of quite funny, because I think it surprised a lot of people that I had these very healthy, normal pregnancies, even though I was, you know, super morbidly obese in the medical terms. When I was at the doctor's office the other day, I had sort of a good laugh with the nurse because she was taking my blood pressure, and it was 111/72, which even for me is low. I generally have normal blood pressure. I've never had high blood pressure, but it is sort of on the higher range of normal, I guess. 111/72 is pretty low for me, and I'm sure that it probably had something to do with my diet. But yeah, she said right to my face, "Oh, I would have assumed it was going to be higher." Like, basically, "Hey, fatty, I assumed you would have high blood pressure because you're so freaking fat." So I just laughed it off, because honestly, what are you going to do at that point? But in the medical profession, there just are so many people who are ignorant to, you know, what overweight people go through or what it really means to be overweight, and just feel like every problem you have can be solved by losing weight. And I don't really think that's true. So anyway, I wanted to talk a little bit about that, because I think for those of you who are watching that are in the same position, you probably have had that same experience with a doctor who wants to blame everything on your weight. And I'm here to tell you that even as a super morbidly obese person, it doesn't mean that you're going to have issues. It doesn't mean that there's going to be problems. And if you have a doctor who blames everything on that, then you need to find someone else who understands that it's only part of your medical history. It's not the be all and end all. So yeah, so today was about doctors, and tomorrow or the next day, I'll be making another video just talking a little bit more again about pre-op stuff. So I hope that you'll join me. Looking forward to it. Have a great day.